Hi everyone! So in this video lecture we're going to talk about the DSM diagnostic criteria for borderline personality disorder. So as we talked about in class, borderline personality disorder is one of our cluster B personality disorders, so it's in the dramatic erratic cluster. And we talked generally about the diagnosis and how it's characterized by pervasive instability, and that's instability in a range of domains. So unstable affect, unstable behavior, unstable sense of self, and unstable interpersonal relationships. So here we'll talk a little bit more in depth about how that is operationalized in the DSM criteria for the disorder. So the overall DSM criteria for borderline personality disorder is that it is characterized by a pervasive pattern of instability of interpersonal relationships, self-image and affect, and marked impulsivity, beginning by early adulthood and present in a variety of contexts. So remember that this is one of our personality disorders, so by definition we know that this is affecting a range of domains, so cognition, affect, behavior, and interpersonal relationships, that it's present from early in development, and that it's stable across time and across contexts. Specifically for borderline personality disorder, we're going to require the presence of at least 5 symptoms, and we'll talk about the different symptoms and the different domains of instability that they represent. So the first domain of instability is interpersonal instability, so thinking about characteristics of interpersonal relationships. One very defining symptom of borderline personality disorder is frantic efforts to avoid real or imagined abandonment. So many individuals with borderline personality disorder are very sensitive to any potential sense of abandonment. So this might be something minor, like someone being late to meet them somewhere, and when they experience real or perceived abandonment, they have very intense emotional responses. So they may experience intense panic, very intense anger, or very intense despair. And they can also have very intense behavioral responses to this perceived abandonment, including a common symptom, which we'll talk about, which is a different symptom of the disorder, self-harming behaviors, which sometimes occur in response to perceived or real abandonment. And often the kinds of situations that can lead to this perceived abandonment are interpersonal interactions that we would generally consider to be fairly minor. So for example, I had a patient with borderline personality disorder that I was treating, and one week I got the flu, and I had to cancel both of our sessions for that week. And the following week, when I came to our next session, we spent a lot of time talking about how angry and upset she had been with me because I had to cancel our meetings that week. And she knew that I was sick and she understood why I had canceled it, but she felt very, very hurt by that because she felt that by being ill and by not coming in, I really wasn't meeting her needs, and that had been very upsetting to her. So a kind of situation that most people would not interpret as abandonment, she perceived of as threatening that I was abandoning her and didn't care about her, and her emotional response to that was very intense. So that's very characteristic of borderline personality disorder. Another really defining characteristic of borderline personality disorder is that their interpersonal relationships tend to be very extreme. So their relationships tend to be very unstable and intense, and to alternate between very, very positive extremes of idealization, then very quickly followed by interpretations in the complete opposite direction. So I mentioned that one of the kind of most popular trade books about borderline personality disorder is called I Hate You, Don't Leave Me. And that really captures this instability and intensity. So they tend to form new relationships kind of very quickly and intensely. So when they meet someone new, they may idealize that person, think that this person is fantastic, they are so wonderful, and very easily and quickly want to form a very intimate relationship, so spend all of their time together, share very intimate details of their lives. But this interpersonal relationship is also going to demonstrate this pattern of reactivity, that if that very idealized person does anything to challenge that idealization, they go immediately from being idealized to being demonized. So they might develop a new relationship, have a new partner, and this partner is so fantastic, they are so in love, it's the best relationship they've ever been in, this person is fantastic. and then they have a minor conflict, and suddenly this person is awful, they're the worst, they can't believe that they ever saw anything in this person, this person should be fired from their job, no one should spend any time with this person ever. So kind of very extreme differences in terms of how the other person is perceived and valued, and also in how their relationship unfolds. So being very close, being very intimate, spending a lot of time together versus extreme rejection. And over the course of a relationship within borderline personality disorder, you can see very rapid shifting among these. So it's not just always perfect and then demonized and goes away. You can go back and forth. So these are very volatile relationships that are very intense and very reactive. So these two symptoms really characterize many of the interpersonal traits that are unstable in borderline personality disorder. Thinking about the domain of identity, this is another domain where we'll see a lot of characteristic instability in this disorder. So one way that you can see identity instability is by disturbances of identity. So an individual whose self-image or sense of self is persistently unstable, that they don't really have a core sense of who they are or what kind of person they are. So I had one patient that I was doing an assessment with who was ultimately diagnosed with borderline personality disorder. And the way that she described herself, she said that every couple of months she totally changed the kind of person she was. So she was a college student, but she was describing that ever since high school, about every 3 months, she would just totally change the group that she was with. So sometimes she was a jock, and sometimes she was with the artsy students, and sometimes she was with the choir students, and her sense of self was very much determined by the group that she was identifying with during that period in time. So she would change her wardrobe, she would get new clothes, she would talk differently, she would be interested in different things, she listened to different music, she watched different TV shows, she talked about having different interests, and she really didn't feel like she had any core sense of self that was stable across all of these groups. So she had very unusual changes in her sense of self, and her sense of self really didn't represent any kind of core stable sense of self-concept, but was very, very susceptible to external influences. So that kind of very disturbed identity, that unstable identity, that lack of a sense of self is very characteristic of that instability of identity that characterizes this disorder. And one way this can manifest is with chronic feelings of emptiness. So because this sense of self really is externally determined, a person might have a sense that at their core, that they don't feel like they have an independent sense of self that is separate from their external influences. And often this is experienced as a sense of emptiness and a lack of a sense of self. And that can be very distressing. So if I'm doing an assessment and I ask a person, how would you describe yourself? What are you like? And they bring up these feelings of emptiness, that often is a cue for me that I want to ask about other characteristics of borderline personality disorder, because it's a fairly uncommon description from people without borderline personality disorder. But for people with borderline personality disorder, it's a very common experience. So not everybody with borderline personality disorder has this symptom, but often if somebody has other symptoms of the disorder, if you ask them, do you ever feel empty inside? Or do you feel like you don't really have a sense of self outside of how you relate to other people? Often people will respond very positively. They'll say, yes, that's exactly how I feel. I don't feel like I have a self or an identity unless I'm thinking about myself in relation to other people. So there's not only that identity instability, but the sense that identity really is determined by these external forces. Our next domain of instability is behavioral instability. So one way that this can be manifested is impulsive behavior. So for the DSM to meet this criteria, an individual would have to show impulsivity in at least 2 areas that are potentially self-damaging. So this might include things like spending behaviors, sexual behaviors, alcohol or substance abuse, reckless driving, binge eating, a range of behaviors in which a person's impulsivity in behavior is potentially harmful to themselves. Self-harming behaviors are excluded from this symptom because we treat them as a separate symptom. So, but these other kinds of behavioral instability would be considered evidence for behavioral instability and behavioral reactivity. Specifically, we also have a symptom to address a very, very common and very characteristic symptom of borderline personality disorder, which is self-harming behavior. So this can be manifested in a range of ways. This can include suicidal behavior. So this might include suicidal ideation, suicide attempts, suicidal gestures or threats of suicide. And it might also include self-harming behavior that is not suicidal. And in comparison to other disorders, rates of suicidality, so suicidal ideation, suicide attempts, and also these non-suicidal self-injuring behaviors are more common in borderline personality disorder than many other disorders. And often this is maybe the most prominent or characteristic symptom that an individual with borderline personality disorder is exhibiting. And often this is the reason that they are in treatment. So when we talk next week about the disorder, we'll talk about the difference in prevalence in the general population versus in the treatment-seeking population. The prevalence of the disorder is generally low in the general population, but if you look at outpatient or inpatient treatment-seeking samples, the prevalence of the disorder is much higher. And many of the ways that people end up in those treatment settings are because they are experiencing suicidal ideation, have attempted suicide, or are engaging in self-harming behaviors. And many of these are very ego-dystonic, so people find these symptoms to be distressing and want to be able to address those symptoms. So these are some of the unstable behaviors that we can see in borderline personality disorder. And then finally, the last domain is that we might see affective instability, so unstable emotional experiences. These might include very intense affective experiences, and they might also include very reactive and very changeable affective experiences. So in general, borderline personality disorder is characterized by rapidly changing mood that changes dramatically in reaction to external circumstances or events, and very, very intense affective experiences. So one symptom is just describing this affective instability due to reactivity of mood. So this might be characterized by intense dysphoria, irritability, anger, anxiety, that typically lasts just a few hours and is not typically sustained longer than a few days. So one way that we can distinguish this from something like bipolar disorder or mania is by looking at the duration of that intense affect and also looking at whether this is reactive affect. So unlike the kind of sustained euphoria or sustained depression that you might see in bipolar disorder or depression, this is very intense reactive mood that can last anywhere from a few minutes to a few days. And it can change very, very rapidly over the course of a short period of time. So for example, the patient that I mentioned to you who was very upset when I had the flu and couldn't meet with her, had another experience while I was working with her where her car had been blocked in the parking lot of a 7-Eleven during a snowstorm. So there were very high piles of snow and someone's car was behind her when she went to get out, and she was very upset by this and she needed to go to work. And she'd just come out of the 7-Eleven and she had a gallon of milk and she was very angry, so she dumped the gallon of milk over the windshield of the car that was blocking her in. And then she walked back into the 7-Eleven and she started yelling at everybody in the store and threatening people and saying that whoever had blocked her in needed to move their car or she was going to harm them. So she had a very, very intense, angry outburst. But then very, very quickly after this, while she was in the store, she was suddenly overcome by very intense guilt and shame and distress because she felt very embarrassed that she had dumped the milk out, that she had come into the 7-Eleven, that people were looking at her, that she was behaving erratically. So then she started crying in front of everybody and became very, very, very distressed and very upset and felt very upset with herself to the point that she was experiencing some suicidal ideation. So that kind of very rapid mood shift, so very reactive to the experience, that very, very intense affect to the point of being inappropriate, And that lability, so going very quickly from one mood to another, is characteristic of this kind of intense affective instability. And finally, another characteristic element of affective instability is that there's often inappropriate or intense anger, or sometimes difficulty controlling anger. So that kind of angry outburst of dumping milk on the windshield of the car that blocked you in is another kind of characteristic element of affective instability. There's also a very interesting symptom in which some individuals with borderline personality disorder, when they experience intense stress, will experience transient, unusual symptoms. So they might experience some psychotic-like symptoms, things like paranoid ideation, or they may actually dissociate in response to stress. So these are not symptoms that are severe enough to meet criteria for another disorder like a psychotic disorder or a trauma-related disorder. They tend to be pretty transient, so they might last a few minutes, they might last a little bit longer than that, but when these individuals experience stress, particularly interpersonal stress related to those fears of abandonment, they may have these very unusual and intense stress-related reactions of dissociating or experiencing psychotic symptoms like paranoia. So that sums up our symptoms of borderline personality disorder. So again, this is one of our personality disorders, so it is pervasive, it's affecting a variety of domains. It is chronic and long-standing, so it emerges before early adulthood and is persistent across a long period of time. And for borderline personality disorder, our defining characteristic is this instability. So instability of interpersonal relationships, identity, affect, and behavior, as manifested by at least 5 of the symptoms that we have discussed. So I look forward to talking more about this disorder with you next week.